this lesson, we're going to talk about the electrolytes that are involved in cardiac conduction. Now, before we get started, I want to make sure that you guys refer to your fluid and electrolyte lesson for additional information or more specific information regarding fluid and electrolytes. Here, I'm just going to stick with the ones that are involved with the heart, mainly because that's all I know. That's my thing. I love the heart. And so we're going to just talk about the ones that are involved with cardiac conduction. And that would be sodium, potassium, calcium, and magnesium. These electrolytes are involved with the conduction and contraction of the heart. So you always got to make sure that you keep an eye out for your patient's electrolyte values, because these help the heart maintain a good rhythm. Without it, we would have some crazy arrhythmias, and you don't want those. So let's break them down and talk about each one of them on how it is that they work. Sodium and calcium are the main extracellular electrolytes. That means they live outside of the cell, whether they are in the vascular area or in between the cells. That is where sodium and calcium live. They are both positively charged electrolytes. If I were to draw my patient's blood and check their sodium values, it would be between 135 and 145. Their calcium would be between 8.4 and 10.2. So as you can see, there is a lot more sodium hanging out versus calcium. Sodium is the most abundant one. And so there's a lot of sodium electrolytes hanging out outside of the cell. Now let's talk about the ones that are inside of the cell. That would be potassium and magnesium. They are both also positively charged. But I know that all of y'all have heard about potassium. It is that important. And I'm about to explain to you guys why, but do understand that always know what your patient's potassium values are. So if we were to get a blood sample and draw their potassium values, it would be between 3.5 and 5.5. Now, there is a little bit of potassium that hangs out outside of the cell, but not as much as there is inside the cell. Okay. Magnesium is also intracellular, and magnesium values outside of the cell is 1.6 to 2.6. So again, it's not that much. Potassium and magnesium go hand in hand. Usually if mag is low, potassium is low. For the most part, magnesium keeps potassium in check and it prevents it from leaking out. So you got to have mag in order for potassium to stay in the cell. So let's put all four of these together on how they actually work in order for it to generate an action potential. So here's our heart. Yes, I know that's not really what it looks like, but it's beautiful. That's a blood vessel. It's a tissue. And so this is where blood would be circulating, white blood cells, red blood cells, plasma, proteins, all that good stuff over here. If I were to take a chunk out of that heart, that's what I'm trying to show you guys right here. So in the tissue, we have cells. What's in the cells? Potassium. So every single one of our cells is flooded with potassium. Potassium likes to live inside. It's not like sodium, where sodium is okay with living outside. Potassium wants a home. So in between the cells, in the vascular area, everywhere else is sodium. And remember that sodium is positively charged. Along with sodium, we have calcium. But if you remember a few slides ago, there's not as much calcium as there is sodium, but it lives outside as well. And in the cell is magnesium. All right, so because there's so much more sodium outside of the cell, our cells tend to be, the outside tends to be more positive. So the inside of the cell tends to be more negatively charged compared to the outside. So the fact that it is more negatively charged is what creates an action potential. So what happens is the sodium and calcium channels open. This allows sodium to rapidly enter that cell. As sodium is entering the cell, Potassium kind of goes, yeah, I don't think so. And potassium leaves the cell. Think of sodium and potassium like they're antagonists. If one is in, the other one is out. If one is out, then the other one is in. They don't like to be with each other. So, whenever sodium rapidly enters every single cell and potassium leaves, the action of potassium leaving the cell is what causes depolarization or the heart to contract. Gotta have sodium entering, potassium leaving, depolarization occurs. Calcium, let's talk about calcium. Here's where calcium likes to come in. Once sodium has entered, potassium is trying to leave, calcium decides to come in, and calcium has a very important job. It increases the strength of the contraction. It makes it so that the heart contracts stronger. We don't want our heart to just kind of go, boop, a little weak contraction. No, we want that heart to contract hard, forceful, so that the blood can go from here to here or to the body. If we have a very weak contraction, blood is not going to go to where it needs to go. So that's calcium's job, is to make sure that that heart does what it needs to and that it contracts. It increases the strength of the contraction so that it is a strong, forceful contraction. So after all this has happened and the heart has finished depolarizing and contraction is complete, the sodium and calcium channels close. Sodium and calcium then leave the cell because it's done doing its job. It's done depolarizing. So as sodium is leaving, potassium then goes, okay, I'm coming back in. Since sodium is out, potassium goes back in. So as potassium re-enters the cell, it needs the help of magnesium. Remember, magnesium prevents it from leaking. So mag is now saying, all right, I'm going to hold on to potassium. You stay inside. So this causes repolarization. So as, again, potassium goes back inside the cell, it causes the heart to repolarize or to rest. One important thing you need to understand about potassium is that it produces the T waves on an EKG. Now, I'm going to talk about the waveforms on an EKG in another lesson, but for now, just know that that is the T wave. So whenever potassium re-enters the cell, and potassium causes repolarization, or for the heart to rest because it is, or the ventricles really, for it to be filling back up with blood, it causes this T wave. Whenever you hear that we have elevated T waves, that usually means that the potassium levels are high. And so the repolarization does not occur as smoothly as it needs to because there's extra potassium in there. So the heart is not relaxing as good as it needs to. So whenever you think of a patient having high potassium or you see high T waves on an EKG, always go check that potassium value because this is where the heart repolarizes. That's what that waveform tells us. And something else I want to mention regarding calcium. How many times have y'all had patients that are on calcium channel blockers? Pretty sure quite often. So if you think about what calcium actually does, calcium channels open and it allows calcium to enter the cell. This causes a strong contraction. If we block those channels from opening and calcium does not enter the cell, what happens? Our heart has a weaker contraction. Well, why in the name of whatever? Why would we ever want this? Well, we do. When we have patients who have hypertension or their little heart is just working too hard, we want to decrease the workload of the heart. And so taking calcium channel blockers does that. It also dilates the arteries so that people who have hypertension, their arteries are not so constricted and that heart is not working that hard. So that's why calcium channel blockers are very good and very effective drugs. And I hope this makes sense as to how it works and why it works. Now let's talk about the key points. Sodium Extracellular, remember, it lives outside of the cell. These are the major electrolytes that are involved in cardiac conduction: sodium, calcium, potassium, and magnesium. Sodium initiates the action potential for contraction. So sodium goes in the cell and then out of the cell. Calcium is the other extracellular contraction. It has a very, very, very important role, and that is to increase the strength of the contraction. It has to make that heart pump harder so that blood can get to where it needs to. Potassium. Can't live without potassium. Gotta have potassium. Potassium is the main electrolyte responsible for depolarization and repolarization, meaning the heart contracts and it rests. T waves is what potassium produces because of repolarization. So whenever that potassium is going back into the cell and the heart is repolarizing, meaning the heart is resting, T waves are being produced on an EKG. And lastly, magnesium. Magnesium is also intracellular, and it helps with repolarization because it goes hand in hand with potassium. And just lastly, if mag is ever low, potassium is usually low. So always know your 2 lab values. Well, know every single lab value, but potassium and magnesium are that important because they also create a lot of arrhythmias, a lot of ventricular arrhythmias. So always got to know what they are. So I hope that this has helped you guys and it gives you a little bit of an understanding about the electrolytes involved in cardiac conduction. Always keep it simple, y'all. It gives you a basic understanding on how this works. Now, if you do need additional information regarding fluid and electrolytes and more specific information, make sure that you guys refer to the fluid and electrolyte section, okay? But I hope that this has helped and I hope that this has made sense. And as always, go out and be your best selves today and happy nursing.